Howdy, everyone. Matt here. I got a question for you. How good do you think the treatment advice is from people like physicians, PAs, nurse practitioners, those people who refer to physical therapy? How good do you think it really is? Let's talk about it. All right, everyone. First and foremost, let me introduce myself. My name is Matt. I am Matt the PT, coming at you with another video on another topic of something from the physical therapy world. But first off, thank you to everyone who has subscribed. If you hadn't hit that subscribe button down below, just go ahead and tap that. Anyway, let's get in on this topic of how good do you think the treatment advice, I'm not talking about the diagnostic ability, I'm not talking about the diagnosing of conditions, but the actual treatment advice is from physicians or, general to specialists or nurse practitioners or physicians assistants. So how good do you think that actual advice is on, and I'm talking about the what to do for the problem or the condition or the issue that someone has. And I'm going to tell you for myself, in my experience, I don't believe it's very good. I don't believe it is very good at all when it gets down to the nitty gritty on what they tell patients to actually do. And this probably be a controversial take, but honestly, take a handful of patients. If you look back through past couple of weeks, and if you have a patient with, back pain, I'm probably going to talk a little bit more, orthopedic type stuff here. But how often, if you just look over the past few weeks, was the advice that someone was given on exactly what to do actually even up to date with what the current evidence is showing, or actually even beneficial? And, I'll just give you a handful that I've had here recently. Had somebody get referred to me with back pain. Somebody just got back pain. Having to be able to read through the note. And you know what they were told? Oh, you need to work on core stabilization. How true is that? Okay. Is a weak core the problem? Is a weak core what causes back pain? Oh, is that relevant? Maybe a handful of people, maybe a certain percentage. But how do you know that? And I bring this up with people like, okay, how do we measure that? How do we measure to know when you're strong versus when you're not? Okay. Like, and how is that? Oh, you need to work on your posture mechanics. Now, posture can be a component, but is posture everything? Is posture the contributing factor? Which, funny enough, this person that came in, actually, when they sat down, they felt better. So it wasn't a posture thing. It wasn't really that they sit and that makes them worse. So why are you talking about posture? How much is posture playing into this? Okay, how often do you get those things? I got another thing. When it comes to like the treatment of like things that are actually a cervical radiculopathy, I screen people's spines all the time. And it is amazing how cervical radiculopathy is actually missed so often. I got a couple examples of that are real interesting. I had somebody that came to me, had a shoulder pain. And the way that they were talking about it, it did not sound like it was actually the shoulder itself. Screen the rotator cuff musculature didn't really seem like that. They had good motion, they're exercising movements, it wasn't unstable, none of that. I said, well, this sounds more like a cervical radiculopathy. And the person, they were kind of on the fence of it. I was like, no, let's really focus on. Let's really focus on, your neck. Well, within a couple of days, they went to an orthopedic, and the orthopedic is like, oh, why are they looking at your neck, at your shoulder? Here's all some shoulder stuff. You want to know what they gave them? Do you want to know? They gave them, now keep in mind, this person had full range of motion. They could reach all the way overhead. It was a little painful all the way overhead. Had pretty good strength in the shoulder. Pain was their limiting factor. Was still exercising. Was still doing resistance training on their own. They gave them pendulums. Okay, pendulums. Doing horizontal adduction stretch. Okay. Wall slides. Okay. You're saying it's his shoulder that's the problem, but you're not even given things that would be indicative of somebody with a shoulder problem with this. So you gave them very low level exercises, and you're upset at me because I screened the neck and actually documented why I thought it was the neck and showed that the pain actually got better with movement after we did certain cervical motions. That wasn't it. I had somebody come in recently as well. I had diagnosed them with a cervical radiculopathy. They go to see a physician. Oh, it's thoracic outlet. No, it's not. No, it's not. Now you put something into this person's head that no, 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 no. No, no. It wasn't that. It was not that. Okay. And think about other stuff. I've heard this from people, the pelvic floor therapist. It drives them nuts. Somebody goes and sees a physician. Oh, I'm having some leakage issues. Oh, you need to do Kegels. Just do a bunch of Kegels. Just do Kegels. Is that the correct thing to do for this person? Did you examine them? Did you figure out what is actually causing their issue? No, not at all. I'll talk about other stuff. How often when somebody goes with an elbow pain, oh, here's some stretches. Let me dust off this sheet. Let me get these wrist stretches in. Do all these wrist stretches. Is that what you need for a lateral epicondylitis? Look at podiatrist. How often are they sending people for plantar fasciitis? No, let's just stick you in the boot. Let's do some shots. Maybe we need a surgery. Okay. Honestly, for as much as we talk in therapy in that we argue with one another over what is the best stuff with treatment, we don't ever go to these other people that we want to refer to, or a source of where people will typically go as well. People are more like, hey, something's hurting. I'm going to go see the doctor. That's what people say. I'm going to go see the doctor. They are not even having they're not even giving out the appropriate treatment advice. Okay. How often is it somebody's pain caused from something being tight? How often do they need to heat or ice it? Okay. How long do they just need to keep just giving them medication? We talk about that. And you know what? We sit there and fight over here when we're not going to them to say, you're not giving the appropriate treatment advice. There's that big thing now where they're like, doctors only get, 10 minutes of nutritional coursework in med school or whatever that they say now. We're not saying, hey, they're not getting enough rehab advice. And really, if all the advice was, oh, you got something going on. I'm going to refer you over to this physical therapist. They're going to tell you, well, what do I need to do? Talk to them. They're going to know more about this than I do. Okay. Do physicians do that? If a primary care, if somebody went in and said, I think it's heart problems, are they going to tell you, well, the cardiologist is going to do this, and they're going to tell the cardiologist what to do? Okay. No, they're going to no, we're going to send you to the cardiologist. They're going to do some testing on you. Same thing. If you go to a, cardiologist and it's possibly a cancer, are they going to tell you how to treat it? Or are they going to go, no, we're going to send you to the oncologist, and the oncologist is going to do what they need to do. Okay. That's the thing. Why are we not going to them and talking to this? And I think this is also interesting, for as much as everyone's crapping on the, going into physical therapy and the whole thing with the personal trainer stuff. Oh, I would have been a personal trainer. Oh, go be a PA or a nurse practitioner. So you're just continuing to contribute to the fact that these people don't know just a group of people who don't know proper rehab, who don't know how to actually rehab somebody on exactly what to do. Okay. I really just imagine all these people that just go to be a nurse or a PA, that all they're end up doing is just telling, just go out here. That's all they're going to do. So it's throwing out referrals. Or how often do you actually see any of those people like, okay, let me instruct you in an exercise, or let me assess you enough to instruct you on exactly what to do. Okay. You're going to lay here. You're going to do this. You're going to lift this. Or they're just going to you're just going to do this and then this. And then they walk out the room. Oh, here's a sheet of exercises. And they walk out the room. Okay. How do you know if they're doing it right? How do you know how to progress them? How do you know to regress them if they need be? How do you know to make those modifications? No, you don't. They don't. Okay. Okay. Do these for 6 weeks and come back. Ton of time happens in 6 weeks. No progression in 6 weeks, no modifications if something doesn't get better, no answering of questions and all that. Okay. That's the thing. I really wholeheartedly believe we need to have that conversation. And I'll wrap up with this. I actually saw a video on TikTok. It was a physician or an orthopedic physician and a sports physician. I believe that's what it was. So podiatrist, and they were talking about ankle sprains. They're like, you shouldn't just rest an ankle sprain. So there's some good advice. You need to do, you just rest it. You need to be active and gradual loading. How? They never said refer to a physical therapist to instruct on what to actually do. You need to do gradual resistance and reactive stuff. How do you do that? How does the average person know how to do that? Again, goes back to a video that I made before. How athletic is the average person? Okay. Go to the gym. Do most people, could you just grab anybody and tell them, hey, write me a program? How do you do these exercises? Can anybody just teach you or know how to do exercises? It's very hard for many people to understand how to do an exercise, how to move their body, how to, again, do I know when to progress it? How do I know to regress it? How do I know to add variables? So when do I know when it's good or when it's bad? How do they know any of that? How do you do, how do you do any of that? But yeah, let's just tell people, yeah, just do all this stuff. I really think that's a big problem of why people are still continuing to deal with issues, is that they're not being sent or instructed in the actual correct things to do. Okay. It's just too much information. Okay. And I will die on that hill right there. Okay. I don't believe that most physicians know exactly what to do for rehab. And if you want to come at me on that, who went to school for rehab on doing this? Who went to school for this? Who's all their education, all their knowledge, all their experience is in doing this and understanding this? Who can talk more about it? Okay. We can. We in physical therapy. That is our world. That is our roundhouse. That is what we do. Okay. We don't have to shoulder the whole burden of telling them what to do. Hey, I'm going to refer you over to them. They're going to talk with you. Don't give them direction on anything. Don't again, and I brought this up in the past. Don't tell them, well, they're just going to give you a home exercise sheet. Oh, they're just going to do this. No, I'm going to refer you over to them. They're going to take care of you. That's it. That's super simple. That's it. They're going to know more about that than I do. I'm just going to refer you over to them. It's going to take care of you. Guess what? We're an ally. That's an ally. Okay. We're all on the same team. We're all on the same team. The patient's in the middle. We're trying to help them. We're all on the same team. Okay. Okay. We don't prescribe medications. I'm not going to tell anybody about what to do with medications. I'm going to refer back to a physician. I'm not going to tell them what to do with surgery. That refer back over to a physician. I'm not going to do whatever kind of lab or testing. That's not what I do. I'm going to refer back over to someone else who can. That's how it should work. Okay. So quit giving this rehab advice. I'm just going to be honest. It's not very good. Anyway, if you have a horror story on that or whatever, share it down below. I would love to see that. That would be so interesting to hear some of that. If you enjoyed the video, please hit that like button. And of course, subscribe to the channel. It doesn't cost you a copay or anything like that. And until next time, take care of yourself. Take care of your patients. I'll see you then.